In this lecture, we are going to learn about pulmonary arterial hypertension in children. Welcome to this lecture. First, we are going to start with introduction. In introduction, we needed to learn what is pulmonary hypertension. Pulmonary hypertension is a disorder where the blood flow that leaves the right side of the heart faces an increase in resistance. Normally, blood flows from the right side of the heart into the pulmonary arteries and smaller blood vessels in the lungs. The blood vessels have muscles in their walls that can relax or contract to allow more or less blood flow to enter. This is the normal function of the blood vessels in the lungs. It allows their walls, they can relax or contract to allow more of blood flow to enter. But in pulmonary hypertension, the blood vessels of the lungs have an increased amount of muscles in the walls. This causes an higher resistance in the lungs. The right side of the heart then has to work harder to pump blood out of the lungs. The right side of the heart will enlarge and thicken in response to this extra work. With the time, how it comes about, you need to understand the normal functioning of the normal functioning of the pulmonary arteries. Pulmonary hypertension may have no obvious cause. However, their secondary pulmonary hypertension may occur in many other types of diseases. Example of diseases are congenital heart disease, severe forms of lung diseases, connective tissue disease. Sickle cell disease also can be one of the cause incidents. The incidence of idiopathic pulmonary hypertension is 8 out of 100,000 people. Women between the age of 20 and 40 are most at the risk. However, pulmonary hypertension can occur at any age. We are now going to talk about signs and symptoms. The most common symptoms of pulmonary hypertension are related to breathing. For example, we have progressive shortness of breath. This happens especially with activity. We have hyperventilation. Breathing harder and faster. We have fatigue, getting tired easily, fainting, lightheadedness or dizziness, coughing up blood. On physical examination, you are likely to observe the following. There will be bulging neck veins, swelling of the legs and hands due to fluid retention. You will also feel enlarged liver. All these signs are related to the right side of the heart working harder to pump blood into the high resistance of the blood vessels in the lungs. Diagnosis. An electrocardiogram is performed to see if there is enlargement of the right side of the heart. We can also do chest X-ray. In chest X-ray, you will see enlargement of the heart. We can also do an echocardiogram or ultrasound of the heart. It is often used to follow the progression of the disease. An echocardiogram can show enlargement of the right side of the heart and can sometimes estimate the pressure. We also have a 6-minute walk test. This is used to evaluate the exercise capacity and response to therapy. During this test, an oxygen saturation monitor on the side of the aid, and the patient walks along the measured course at their own pace for 6 minutes. Continuation. The best way to diagnose this pulmonary hypertension is to use catheterization. This will actually measure the pressure on the right side of the heart. And what makes diagnosis of pulmonary hypertension is cardiac resistance of the blood vessels. You will notice there will be cardiac resistance of the blood vessels in the lungs. Various medicines may be used during a cardiac catheterization to see if blood vessels in the lungs will relax in response to them. This may lower the pressure in the lungs and can help guide the therapy. So, there is assignment for you. In the comment section, could you please tell me some of the medication used during this catheterization? There are some medicine which are being used. I want to see in the comment section. We go to treatment. In treatment, there is no cure for pulmonary hypertension, but there are now treatments that have been found to relieve some of the symptoms and slow the progression of the disease. First management is oxygen therapy. Oxygen can be used at home and often helps with breathing issues. It is also known as to relax the muscles in the arteries of the lungs, which will lower the pressure in the pulmonary arteries. Another management is use of diuretics. These are drugs used to get rid of excess fluid in the body and reduce the amount of work on the heart. We have calcium channel blockers. Drugs that can relax the muscles in the blood vessels walls and help tighten the side of the heart work better. Although calcium channel blockers have been proven to be effective, only a small number of patients respond to these drugs. You may go ahead to find out what are some of the diuretic drugs. I was not able to, I have not mentioned them here, but you can find out also calcium channel blockers. You need to know them, which are the examples of calcium channel blockers. Another treatment we have this phosphodiesterase 5 inhibitors. These drugs, they relax the blood vessels in the lungs to allow blood to flow through more easily. Because in pulmonary hypertension, we have a problem with our blood vessels, but when we use this drug, it will relax the blood vessels in the lungs, and this will allow blood to flow through more easily. This class of drugs is often used in combination with other drugs to lower pulmonary artery pressure. For example, sildenafil, tadalafil. Those are the two examples. Another treatment we can use endothelial receptor antagonist. Another treatment we can use prostacyclins. Drugs shown to slow the progress of pulmonary hypertension. They are available in many forms, but are most commonly used as chronic infusion. These drugs are also available to take orally or as an inhaler. We have anticoagulant therapies. The main function of these anticoagulant therapies is to reduce blood clots from forming in the pulmonary blood vessels. Because if blood clots form in the blood vessel, it is very dangerous to our patient. Prognosis. The long-term prognosis for pulmonary hypertension depends on its cause. The severity of the disease at the time of diagnosis and response to therapy. Recent advances in medicine therapies have had a profound impact on the outcome of the pulmonary hypertension. If the disease does not progress to the point that symptoms are excessively severe, some patients may be suitable for lung transplantation. Thank you for watching. That is the end of